The healthcare industry has undergone enormous changes over the past 2 decades. However, there are multiple challenges that today's healthcare industry is facing. The COVID-19 pandemic highlighted these challenges as hospitals struggled to treat the overwhelming influx of patients. So, to ease the burden of both the patients and the doctors, at first we did some research in the survey. The results clearly show several issues that impact access to care, quality of care, and the cost of care. The majority of the responses included a lot of information about the methods of treatment and how the lack of the proper equipment causes different problems. One of the main problems in healthcare concerns medication and prescription. Principal problems among patients are forgetting to take pills on time, risk of overdose, in case of injection a need for additional help, and doing constant blood tests. Moreover, doctors also face certain problems such as difficulties in organizing patients' prescriptions, monitoring their current health situation, and the unavailability of the past health data. In order to solve the mentioned problems, we came up with the solution which consists of 2 main parts. Measuring device which gives health criteria measurements such as blood pressure or quantity of compounds in the blood. And in case of treatment needing injection, an additional infusion set. An application which is connected to these devices and controls the whole treatment process. Now let's get more into the details of each part of our solution. Our application can be used both by doctors and by patients. The application allows doctors to write prescriptions, to keep track of treatment progress and make adjustments whenever necessary. In addition, they can find overall information about their patients. Patients can use this application as a reminder to take their medicine on time. It's also beneficial for them to see their treatment results and even chat with their doctor or call him. Here is the prototype of our application. As mentioned, this app can be used by doctors and patients. If you are a doctor, you are provided by an account which is created by the hospital. However, if you forgot the password, there is an option to recover it. On the main page of the doctor there is the list of patients. It is possible to add patients by clicking to Add button. Here the doctor need to fill in the personal information of patient, as well as the prescription. On the main page there is also a search button where they can filter patients. If we click on the patient, we go to this page where we can see their personal info, their health state and prescription. Due to this application, doctor has access to patients' past health data and the results of blood tests. As a result, doctors can easily control the whole process of treatment with the help of special up-to-date statistics which are done by the application. On the prescription page there is the list of medication prescribed to the patient. It is possible to add or remove a medicine. Clicking on the medicine, you can see its detailed proportion and also in which pharmacies it is available. There is also an option to contact a patient. And finally, doctors receive the notification if there is a need for intervention. For patients, if they are using this app for the first time, they should create a password and enter their homepage. Here is their current state. There is a page where they can see the medicine which is prescribed to them. Patients have affordance to access the information of each medicine in details, including the proportions and in which pharmacies they are available. Patients receive notifications if it's time to take the medicine or when any of the device readings are too high. Moreover, they can contact the doctor or even call him. What concerns the equipment, there is already an existing device, insulin pump. This is a small electronic device that with the help of sensor measures glucose in the blood and releases the regular insulin your body needs through the day and night, so you don't need to do insulin injections. Combining our ideas with the mentioned device, we created an improved version. The measuring device checks the blood pressure, heart rate, as well as blood compounds such as calcium, glucose, sodium, creatinine, and much more. Then sends the results to the application. Consequently, there is no need to do constant blood tests. As already mentioned, for injections there is another device that takes instructions from the application and delivers the proper amount of medicine. These devices use nanotechnologies, and despite going under the skin they don't cause any pain or discomfort. Thus, injections are done smoothly. These devices are provided by the hospital and all the instructions are controlled by the doctor. In case of emergency situations, such as incorrect functioning, the device shuts down automatically and both doctor and patient are immediately aware of malfunction through notifications. Healthcare is considered the world's most invaluable service. So, we simply cannot put a price on health and well-being. By working the right metrics from the right places and understanding how to transform insight into action, we will improve your life for the better.